This video is for educational purposes only and is not medical advice. Always consult your healthcare provider or pharmacist before making decisions about your medications. Ozempic, Wegovy, Mounjaro, Zepbound. You've probably seen all four names in the news on social media, maybe in your own pharmacy. And if you're confused about what's different between them, you are not alone. Most people, including many patients currently taking one of these medications, don't fully understand the distinction. Here's the core fact that resolves most of the confusion. There are only two molecules. There are four brand names. The brand name tells you who makes it and what it's FDA approved to treat. The molecule tells you how it actually works in your body. Molecule 1, Semaglutide, made by Novo Nordisk. Ozempic, the injection, FDA approved for type 2 diabetes management. Lower doses 0, 5 to 2 milligrams weekly. Wegovy, the injection and now the pill, FDA approved for chronic weight management. Higher dose 2, 4 milligrams weekly. Also approved for cardiovascular risk reduction and fatty liver disease. The oral tablet was FDA approved in December 2025 and is now available in pharmacies nationwide. Same molecule, different dose, different approved use, different brand name. Molecule 2, tirzepatide, made by Eli Lilly. Mounjaro, the injection, FDA approved for type 2 diabetes management. Zepbound, the injection, FDA approved for chronic weight management and obstructive sleep apnea in patients with obesity. Same molecule, different approved use, different brand name. The critical point on off-label use, using Ozempic or Mounjaro specifically for weight loss when you do not have type 2 diabetes, is considered off-label use. A doctor can legally prescribe it that way, but it is not what those specific brands were approved for. If weight management is the goal, Wegovy and Zepbound are the FDA-approved options. Semaglutide is a GLP-1 receptor agonist. GLP-1 is a hormone your body releases after eating. Semaglutide mimics it. It stimulates insulin release, slows stomach emptying, and reduces appetite. Average weight loss on Wegovy in clinical trials, approximately 15% of body weight over 68 weeks. Tirzepatide is a dual GIP and GLP-1 receptor agonist. It activates two pathways simultaneously, GLP-1 and GIP, a second hormone that enhances insulin sensitivity and fat metabolism. The dual mechanism produces stronger appetite suppression and greater metabolic effects. Average weight loss on Zepbound in clinical trials, approximately 20% of body weight over 72 weeks. In the SURMOUNT-5 head-to-head trial, tirzepatide produced significantly greater weight loss than semaglutide at comparable doses. One thing both drugs share: weight returns when you stop taking them. These are long-term treatments, not a course you complete. Most patients regain a significant portion of lost weight within 1 to 2 years of stopping. This should be part of any patient conversation before starting. Side effects are common, especially at the start. Nausea, vomiting, diarrhea, constipation. These are the most frequent reasons patients stop the medication. They often improve as your body adjusts, but they're real and worth knowing about in advance. The FDA label carries serious warnings. Risk of thyroid tumors based on animal data. The significance in humans is still unclear, but patients with a personal or family history of thyroid cancer should discuss this with their doctor. Also, pancreatitis, gallbladder problems, and severe GI events. Cost and Medicare coverage. Starting July 1, 2026, the Medicare GLP-1 bridge covers Wegovy, Zepbound, and Foundayo at $50 per month for eligible Part D members. Through December 2027, this is the first time Medicare has ever covered GLP-1 medications specifically for weight loss. Ozempic and Mounjaro are not part of the bridge. They remain covered only for type 2 diabetes under Standard Part D. If you don't have Medicare, list prices run $900 to $400 per month before insurance. Your pharmacist can help identify savings programs. This is not a decision for social media. These are powerful medications that require a full medical evaluation, health history, cardiovascular risk, kidney function, and realistic expectations about long-term use. Which one is right for you depends on your individual situation, not which one is trending. Your pharmacist can help reviewing your health history, checking for drug interactions, clarifying what your insurance actually covers, and answering the questions your doctor may not have had time for. I'm a pharmacist. Subscribe for more plain language explanations of the medications changing medicine right now.